Welcome to Life, Death, and the Law, presented by the law firm of Beeson, Garner, and Hansen. Hosted by attorneys Sean Garner and Adam Hansen.
Good morning and welcome back to another episode of Life, Death, and the Law. I'm attorney Adam Hansen, and I'm in the studio today with a special treat. We've got Jennifer Hill, who is a registered nurse at YRMC, and we've got Zamira Hernandez, who is also a registered nurse at YRMC. And Jennifer, you contacted me probably a couple weeks ago asking to come on the show because you wanted to raise awareness for an event that's coming up actually this week on Wednesday, the 24th. And it's some sort of a stroke awareness group or what are you doing? Tell us what you're doing.
Well, this is called a stroke support group. So YRMC is allowing us to use their facility, and we have started a stroke support group. And I'm here with Zamira Hernandez, and she's our Tower 5 educator, and she's a big part of helping us with this, get it all set up at the hospital. But basically to help the individuals who've had strokes or their family members come and get support. Because what do you do after the stroke? You know, you come to the hospital, you get treated for the stroke, and then you go home and there's a lot of questions. You know, people aren't sure some of the next steps. You go see your provider, you go see the neurologist, you go see the cardiologist, all the different specialties. Usually they are in contact with afterwards, but then they have additional questions. So we decided to create this support group so that we can answer those additional questions and let them have that additional support.
So if an individual were to have a stroke, they get treated at the hospital. Do they go to Tower 5 where you are, or are they on a different floor?
Oh, yeah. The Tower 5 is, yeah.
So you have a lot of experience with this already. So that you fix them up, you get them back to good health as much as possible. Then they go home. Is life different, or you just go back to normal?
Well, depending on the severity of the stroke, life can be very different. And that's where we're coming in to help out with that. Mm-hmm.
What would you say, just from your experience? I mean, what people that go home that come back to full functioning, what would the percentage be in your mind? I know it's not scientific, but is it few and far between, or is it more likely than not that people will regain function?
It actually depends on the severity of the stroke and what part of the brain is was
affected. Yeah,
affected by the stroke. Yeah, it just
depends.
Does it depend on how quick you get to the hospital? If you start to notice some sort of signs or something of a stroke, the faster you get to the hospital, the sooner you can be treated and hopefully prevent a lot of the damage to the brain, or is it's just kind of like a crapshoot?
Well, there's a couple answers to that. So we have an acronym called Be Fast. Mm-hmm. This is what we tell all the people, like in the community. This is awareness. This is you can find it on American Heart Association, American Stroke Association. Be Fast stands for, these are the signs and symptoms of a stroke. So if you're looking for a stroke, and I'm bringing this up because time is the last one on it. So B is for balance. You're looking at dizziness, loss of balance. E, eyes, we're looking at loss of vision, double vision, blurred vision. F is facial droop. We're all familiar with the facial droop. You see that, you're like, oh my gosh, they're having a stroke. A is for arm. So one arm is drooping. It's usually not both. It's one, not drooping, but weakness in that arm or leg.
Slouched or something on one side?
Well, like you just can't move it. Or it's really weak. Suddenly you had full functioning of that arm, and now it's not functioning correctly, and it's just, you can't lift it up, or it's very weak. So you're looking for that. S is for speech, slurred speech, word salad, we've called it before, where they're trying to think of what they're going to say and it just isn't coming. So, and then T is for time. So when somebody's having a stroke, you have only a certain amount of time where an intervention can take place. And that's why we say get to the hospital as quickly as possible, because if we are able to perform that intervention, if you're if you're not within that window, we can't do it. So,
What are some of the remedies? I mean, say I see a loved one going through the B fast, and I'm like, oh my gosh, these are all signs of a stroke. We need to get you to the emergency room. What can you actually do to prevent or slow the damage of stroke? Do you administer some sort of like...
No. We'll just get to obviously call 911 and get to the hospital as soon as they can so that I can initiate treatment. If they're qualified for this medication that the patients can have, they can start it right away and help reverse those signs and symptoms.
What does that medication do for the layperson?
it basically dissolves the blood clot.
Okay. So when we talk about a stroke, we're talking about some sort of a blockage in the brain,
Yes.
the brain veins. What do you call those?
Arteries, veins,
Arteries.
yeah.
That's the word I was looking for.
Well, and there's two types. You can have there's a couple. So hemorrhagic stroke is a brain bleed. And so that's another thing we're looking for. So that's one of the first tests we look at we do a CT of the brain, and we're looking to make sure you don't have a brain bleed. The second, we're looking for that blockage. But along with that, where was I going with this? Hold on. What were you talking about before?
I asked, it's a blockage of a vein or an artery in your brain.
Oh, yeah. And then there's a transient ischemic attack, which is temporary. So somebody could be having these symptoms, and then all of a sudden they go away. And they're like, oh, okay, that was temporary. It's gone. We still need you to come in. A transient ischemic attack is something that happens. All the symptoms can go away. It's a temporary blockage, but it means that you're more at risk for having a major stroke or more transient ischemic attacks. And we need to find out why you're having these blood clots form. It could be coming from the heart. Could be coming from other areas of the body. So we're going to run additional tests to see why your body is forming these blood clots.
Does a brain bleed happen because there was some sort of blockage and the blood just has nowhere else to go and it bursts, it blows out that vein, or how does that happen? Or the walls of the veins are just kind of thin and deteriorated, and so it's weak?
There's several. So, yeah, an aneurysm could be just hypertension, high blood pressure. Sometimes people aren't even aware they have hypertension until an event happens. It's called one of the silent deadly killers,
But it does that will look like B-fast?
Not every time. No.
They may just have like a headache, like an excruciating headache, start with double vision, and that's when you're like, hey, okay, we need to call 911. Something is going on in the brain.
You got to get it fixed immediately. So years ago, let's see, what is this, 2024? Man, when was this? I want to say 2010, around there. My grandmother woke up one morning, was getting in the shower, and collapsed. And so they rushed her to the hospital because she was exhibiting these signs. And so I think it was her left side, maybe. She was left-handed, but droopy face, all that kind of stuff. And she never recovered. I mean, they got her back a little bit, but it was declined ever since then. And she actually ended up being in a nursing home for the next 10 years just because once they treated her at the hospital, she had to go home. But my grandfather couldn't care for her physically anymore because he's up there in age. And so the care that she needed was at a nursing home. And so for 10 years, she was in that nursing home and eventually just lost all of her memory. She went back to like a child, and it all started with this type of a stroke event. So this happens every day. And you girls are seeing this all the time at YRMC. And so what is this group designed to do? If you have a loved one, those that are listening, if you have a loved one that's experiencing or has experienced something like this, a stroke event, what's the purpose of this group? Why would I want to go? Like, is it important to me, or is it?
So it's very important because a lot of the caregivers and family members, they are, it's a lot of anxiety going home with the patient, the post-stroke survivor, because they have a lot of questions about medications or how am I going to help them, go to bed or take a shower. All these things come into play. So this is a place for them to come and bring these questions, and find the support with other post-stroke survivors and their caregivers. Like, how can they help each other, And then, of course, we have the professionals there helping answer these questions as well.
So when we say that, like this week, we will be having we don't have any speakers this week, but next month in February, we'll be having a cardiologist come and speak to the group. This week, we will be just passing out a questionnaire, getting to know you, and finding out what the needs of the stroke survivors and their families are. We want to know, what do you need? What kind of support do you need at home? And then we're going to take those answers and get the necessary answers for, like, do you need speech therapy, physical therapy? These are all the different specialties that will be attending these groups to help them with additional questions that they have. Neurologists, psych, dietitians, all those types of specialties that will help them. So if they're lacking in some information, that they just need more.
So in my daily practice as a lawyer, you've experienced this, Jennifer, my goal is to help families prepare to meet the inevitable, which would be probably a stroke event or some sort of incapacity event. It could be a car accident, it could be a stroke, it could be a heart attack, something that takes you out to the extent that you're at YRMC for a time to fix that problem. And you're not able to go to the bank, you're not able to go and do things. And so in my daily work, we're helping people put in place legal framework that allows for other people that they trust to come in and manage things in the event that happens. So powers of attorney become very relevant, both in the healthcare world, both in financial world. And ultimately, if something happens to them where they pass away, then they've got either a trust or they've got a will in place that we've put together for them to help designate who's in charge of doing all that. So would that be something where my office could come in and say, hey, you guys that are participating or you have a loved one that's experienced this type of event, they probably have to deal with things legally.
Absolutely. You don't know how many times when those are some of the screening questions we ask everybody that comes to the hospital, like, hey, do you have a healthcare power of attorney? Do you have somebody that can make decisions for you in case you're unable to? And that's even if they're going to have a surgery or not even stroke related, but they're coming to the hospital for whatever. And there's a lot of people, I am surprised by the amount of people, even elderly, that don't have that in place yet. And, so we always, we'll ask them, would you like us to contact the chaplain to have them help you fill out that paperwork? But it's so much easier if they have all that paperwork in place before they come, because they can tell us this is exactly who we want you to contact if, I'm unable to make decisions for myself. And it makes it so much easier in the process. Yes. And we get some people come in that can't make that decision already. And we're looking at the family members who are there and saying, can we run this test? Can we do this? But we have no idea if there's somebody that's supposed to be making those decisions for them already, or if they just don't have any. And if the person that's making those decisions is the one that the patient wants them to make the decisions,
Yeah, and those are the things that I talk to my clients about every day. And I think until you're in that event, it's hard to, this is never going to happen to me. It's never going to happen to me. But you ladies live that every day. Yeah. Where people are coming in the hospital every 10 minutes because of issues that are arising, especially in this demographic in Yuma, I would argue, because of, especially here in the winter, right? When we have an older crowd come in, older and wiser crowd come in. And unfortunately, these medical events happen where they have to go to YRMC. And so my goal as a practitioner is to help them before that happens, have everything up and running so you ladies know who they need to contact or who's going to be in charge of making decisions if they can't. Maybe they're in a persistent coma or vegetative state and they can't make that particular decision. We got to go to break. We're going to talk a little bit more about this event when we come back, and really some of the things that you can do to prevent a stroke if possible, the best that you can. And you ladies are going to teach us about that, right?
We will.
Okay, yes. We'll be right back.
Coming up, more thought-provoking conversations on life, death, and the law right after this.
Welcome back to Life, Death, and Law. I'm attorney Adam Hansen, and previously we were talking to Jennifer Hill, who works at the hospital as a nurse, and we've got Zamira Hernandez that also works at the hospital as a nurse with Jennifer. They're both on Tower 5, so if you ever find yourself at Yuma Regional Medical Center, ask to go to the 5th floor, because that's where the best nurses are. That's what I've heard, right?
We do have really good nurses. Yes.
We do, but there are a lot on the other floors too.
I know. They're all
I
good.
will
They're all
have to
good,
plug
yeah.
that. Yes.
They run the show if you go to the hospital, and a nurse can make or break you, you know. I've experienced, luckily, knock on wood, I've not me personally been admitted to the hospital, but my wife was in there for probably like a month.
Oh, yeah.
Years ago. She had pneumonia, and it developed and became even worse and worse, and they couldn't knock it out. And so I can attest to the fact that a good nurse can make or break the experience. And I know you ladies are some of the best over there at YRMC. So look for these ladies as you, hopefully you don't got to go, but if you go, you're going to say, transfer me to level 5, to tower 5. That's where the good ones are. And you also deal with, we were talking earlier on the last segment about this new group that you put together for stroke advocacy. Really, it's a group to help individuals in our community that have experienced a stroke, or a loved one has experienced a stroke, and now they're trying to live life with that new reality, because the reality is, if you experience a stroke, most likely your life is going to change in some way. You're going to probably need some help physically and mentally, a lot of therapy, that kind of stuff. And so your needs at home are going to change, and that might require physical help from that partner or a loved one. And so it's a whole thing. And that can be a bummer, right? Psychologically, it can really drag a person down, I'm guessing.
Yeah. A lot of stroke survivors will experience depression. I think the literature said within, I think it's within the first 6 weeks they can. Yeah. However, I was taking care of a patient, and I think she was on day 2, and she said, "Jennifer, I'm starting to get depressed." And I thought, oh, wow.
That's crazy that she recognized that.
Like, it's not up to 6 weeks. It can happen right away for some patients, depending on their deficit. If suddenly they were walking and now they're not walking anymore, I mean, think about that emotional toll that takes on an individual. Or even just being able to use that right arm or left arm, or their speech is slurred now. You know, there's a lot of different things, a lot of emotions, and that, am I going to recover all the way? These are some of the questions they ask us, and we don't have the answers to that because we don't know. Some recover and some don't. And some of it is getting into treatment right away, and some of it is just the brain, you know, how bad the stroke was and whether recovery is possible.
Even on the caregiver side, so that loved one that has to now go home with the victim of a stroke. So I think some people are built to be nurses, or they have that mentality. They naturally have this affection for other people and they want to help them. I'm not one of those people. I do. In fact, when people get sick in my household, I get frustrated with them really quickly. I'm like, get out of bed and get to work. You know, we don't have time for this. Get up. But when I'm sick, I want to be doted over. I want soup brought to me in bed. I'm not moving. Like the end of the world.
That can be a guy thing too.
It probably is a guy thing. But I mean, some people are built to be nurses. Jennifer, I know your mother, and she's one of those. I mean, she is a natural nurse, and she will baby people until they are back to health. She will nurse them back to health. I'm not one of those people. And so I in my own mind, I imagine the situation where maybe my wife has a stroke, and I would probably be frustrated. I hate to say that out loud, but I think a lot of people that have to care for their loved ones, now life has changed because that individual can't cook dinner anymore. They can't usually even go potty by themselves. They can't wash themselves sometimes, you know, if it's very severe. And me as an individual, I'm going to be honest, I'd probably be frustrated at the beginning. Like, why me? Why do I have to deal with this?
Well, since Jessica's my sister, I'd help you.
Yeah, I know that, but most people don't have a wonderful nurse as a sister-in-law. And so does this group help people like me if I were in that situation?
Absolutely. Yes. That's a large part of it, is helping those caregivers so they have somebody to talk to.
Right.
We'll have a breakout session where the caregivers will just meet together so they can talk about, hey, what do you do? How do you help your loved one? They have that space where they're able to discuss, you know, different things that they do at home to be able to be helpful. And then the survivors of that stroke will have their own area where they can discuss, how hard it is for them as
Right.
that person going through it. So that we'll be able to break them out in those 2 sessions where they'll have that opportunity to discuss with the people that are living that experience, and get that support that they need. You were talking about what can we do to prevent stroke? A lot of it is just lifestyle changes. The number one cause of stroke is going to be hypertension. But there's
What is that?
high blood
blood
pressure.
Okay.
Yeah. So high blood pressure. And like I said, that's the one that a lot of people don't even realize they have till they go to the doctor and go, oh, my blood pressure is high.
Or many have it and they don't take their medications regularly and it's out of control.
Yeah. They ignore, nothing can happen to me type of thing.
Right.
Diabetes, that's a big contributor as well. High blood cholesterol, sleep apnea. A lot of people don't associate that, but that's one of them as well. Tobacco usage, obesity, excessive alcohol use, illegal drug use, AFib, which is an irregular heartbeat.
That you can't.
No.
That is,
But-
it is what it is.
But there's medication that you can
That you
take.
take.
Okay.
So if you're getting checked out by your doctor regularly, they can find these things out, getting your blood work done, seeing your physician on a regular basis. They'll be able to catch some of these things. And
What
then,
would that look like? Would it be like annually go see the doctor?
Yeah.
Get blood work done just in
Right.
case?
Just in case.
And you'll see some precursors to maybe some issues that you can address with diet, is what I hear you say. Most of it's what we eat.
Right. A lot of it.
And us fat Americans, we just can't help ourselves. Is that what I hear you say?
Yeah, lifestyle. Well, we want you to be active too. If you're
Nah.
if you're sedentary, that's not going to help as well.
Okay, so diet, exercise. I've heard that before.
Some of the risk factors that you cannot control are going to be increased age. So that's why it's helpful to talk to your clients as well. Gender, women are at greater risk,
Is that right? Wow, I wouldn't guess that.
right? Prior strokes. Also, if you have family members who have had strokes, that's something that you can't control, but you are at risk to have them as well. You can be. It's not a guarantee,
Not
but
to
yeah.
happen, but you can.
So that's why the doctor wants to know when you come in,
Family history.
family
yes.
history.
Very
Yeah.
important to
I
know.
always hide that. I'm like, it's none of your business. And I don't. So don't do that. Don't hide your family history.
No,
No.
it'll help the doctor.
Any issues with stroke? No, never heard of it. Heart issues?
None.
Yeah, I've got all those issues. I will probably die of a heart attack. I've already resorted to that, or a gunshot. I don't know, one or the other. If my wife kills me, or my heart goes out. I've already resorted to that fact. How would you let people know that are listening about this event coming up on Wednesday? That's why we had you in, is because it's coming up in 2 days.
Yeah, in 2 days. Yeah, come on out. We feel like you'll get a lot of helpful information. And if we don't have the speaker that you'd like to hear from, we'll get them.
Yep.
So come on out. Let us know what your needs are in the community. We'd love to hear it. We'd love to help you with those needs.
So this is relatively new. Did I cut you off, Zamira?
I was just going to mention that this will take place at the hospital, at the administration building, and at the Yuma conference room. So it'll be at 6 p.m.
So 6 p.m. on January 24th.
Yes.
6 p.m. at January 24th. It looks like it's an hour-long event. You're calling this the YRMC Stroke Support Group. This is the inaugural. This is the first one.
first one. Very-
So
Very
exciting.
excited.
I know.
And but this isn't a one-time thing. It's going to be a monthly meeting
Yes.
for about an hour where you come in and talk. You'll have people educate, and I'm sure it's a forum where people can talk about issues that they're experiencing and get it off their chest and
Right.
find some sort of counseling help there.
And I talked with a gal at that meeting I attended in Utah, and she said that she'd been a part of a stroke support group for 11 years. This is somebody who is just help running one. But she said that the community involvement, as far as it feels like family, these people that have been involved in these support groups for years, and they learn from each other. One thing she said is like somebody didn't have use of a hand, so they brought in some homemade devices that they had developed themselves in order to compensate for that loss. And so that's part of it. Like, share what you're doing at home to help your loved one. People can be quite creative when they lose some part of their body functioning. And anyway, that's part of it.
So Wednesday, the 24th, at 6 o'clock from 6 to 7, it's about an hour long, the YRMC Stroke Support Group inaugural meeting, we're calling it. And Zamira, you said we're going to be meeting in the administration building. So if I'm going to the hospital, you've got, correct me if I'm wrong, the administration building is to the south side by the parking garage.
Correct.
So by the baby delivery.
Correct. Right
area.
next to them.
So if you're gonna turn in off of 24th.
Yes.
So take 24th, heading south.
Heading south. Yeah.
Towards 32nd, and you're going to turn in by the big parking structure.
Correct.
Keep going. There's a building there.
Yes.
It's an outer building, not connected to the hospital. They call that the admin building. And what room was it in?
In the Yuma conference room, and we will have greeters and outside the doors so that they're can help them go.
Yeah, corralled. Any signs do you know of?
No
Pointing
signs.
or no signs.
No signs, but greeters will be there.
Yeah.
All right, you'll get it done. I know this is the inaugural one, so you're going to work out the kinks, and then you're
We
going to
are.
fix it.
Correct.
Isn't that right? We've got to go to a break. We'll be right back after this with Jennifer and Zamira, and we'll talk a little bit more about this upcoming event and some other things that you can do to prevent, hopefully, having to experience one of these medical events. And we'll be right back after this.
Have a question or want to join the conversation? Our phone lines are open. Call 344-5258. That's 344-KBLU.
Welcome back to Life, Death, and Law. I'm attorney Adam Hansen, and we've been talking with Jennifer Hill, who's a hospital nurse at YRMC. We've got Samira Hernandez, who is also a nurse over at the hospital. Both these ladies work on Tower 5, and they've been gracious enough to come in today and educate us as to some of the effects of a stroke. And you might hear this and tune out, but I don't want you to tune out. And regardless of how old you are, it can happen at any time in your life. I've had clients come in with family members that are in their 30s that have experienced a stroke or a heart attack, and it has either killed them or seriously made them incapacitated. And now we have to deal with the legal issues that follow. And so you're not out of the woods just because you're in your 30s, 20s, or 40s. You know, this is something that can happen at any time. It's just kind of like a silent thing. And we talked a little bit last segment about, Jennifer, you brought up some of the ways that we can avoid or do our best to try and avoid a stroke causing event. And a lot of that comes down to your life choices, right?
Right.
So diet and exercise, getting up every day and trying to do a little bit to move, get your blood flowing, keep those arteries nice and primed. And then go to McDonald's and get your breakfast. No, I'm teasing. So yeah, you're going to do things that help your circulation of blood and not develop clots in your arteries and in your veins. Look at me, I'm a doctor already. You guys, you girls, you turn. Now I know everything. Yeah. No, but we're talking about primarily why we had you on today is because we're 2 days before this first meeting that you're calling the YRMC Stroke Support Group. And this is the first time it's happened. You're putting it together because you saw a need, I guess. And Cody, you had some questions.
Yeah, I mean, that was basically it. At what point did you see, a need for this? Because obviously you're dealing with stroke victims and their families. But at what point do you go, all right, we have to get everybody together and just kind of grow this a little bit bigger?
Well, there was go ahead, Zamira, were you?
Like you had mentioned, Jennifer, there is a needs assessment in the community, and this was one of the things that they had wanting, for the community to have a stroke support group. And secondly, we attended a conference back in 2022, right? And one of the topics was a stroke support group. So we thought, we don't have one in Yuma. There's a lot of patients that we're discharging home that they may need a lot of help, questions. So we presented this to the hospital, and leadership approved it for us, to go ahead and start this. And we're excited because I know that a lot of people are going to benefit from this.
Was the leadership, were they enthusiastic about it, or are they just like, yeah, go away, just go do it? Just leave us alone.
They were really.
There's actually a lot of channels we had to go through in order to get this approved, and it was on every level.
Unanimous.
Yes, yeah.
Super excited.
Yeah, we have the support of all the hospital, which is fantastic.
That is awesome because it would be harder, obviously, if you're fighting against administration or something. So it's really good to hear that the hospital's backing you ladies, and
Oh, they were all for it. Yeah.
wonderful. I know you, so Jennifer, you did what was it, 4 months ago, something like that. You had mentioned you were going up to Utah to a conference to present about strokes, and you were kind of nervous about it. This is the first time you're going to be in front of people doing a presentation and things like that. But my understanding is you knocked it out of the park. So how did that come to be, and why did you do that?
Well, this was we were presenting to the DNV basically our idea about.
What's the DNV?
Hold on. I'm trying to remember the exact.
DMV or DN?
DNV.
Department of National.
No.
I forget the
The nurses,
Yeah. It's basically one of
the regulatory body.
regulatory body. Yeah.
Is it national?
Yes.
Yes,
Yes.
it's national.
They help certify the hospital. With
get accredited.
Yeah, get accredited. So,
Oh, okay.
DNV Healthcare Stroke Care Certification Program.
right.
Yes.
Right. So we were presenting this basically to them because it's a conference where you have a lot of presenters. So we went up there to present our idea of this stroke support group, and there were other presenters there who had started support groups that presented as well. It was under one of the categories. I can't remember the name of the category, but anyway, we presented it. They gave us additional ideas there of things that we could add to the support group and incorporate into it. And here we are now.
And so you're starting this new event on Wednesday, the support group here in Yuma. I'm excited. I think it's going to be great. And so if you didn't hear it before, it's at 6 o'clock, 6 to 7. It's an hour long. It's nothing. And at the hospital, at the admin building, which is to the south side of the hospital, it's detached by the big parking structure. So you're going to want to try and get to the hospital using 24th Street most likely, and then turn right or left, depending on where you're coming, 32nd or 24th. But it's the admin building back there. And then it's in the Yuma Conference Center, or conference room. And Samita, you said that there's going to be greeters and stuff to help you get to where you need to go. So those that are listening that have experienced this or are seeking something like this, please go.
Yes.
And because without you, these ladies won't know what to present effectively in the future. Do I hear you correctly? You're listening to the community needs, and then you're going to address those needs as they come about.
Correct. Yes. Yes. And I know a little bit, you had talked about during the break, kind of caregiver fatigue that can happen.
Oh, yeah.
What was your question, Cody?
So, I mean, I guess really you think, all right, this is support for those that have gone through a stroke, but how many, of the caregivers just need a place that, this is new to them? They were a wife or a mother before, or a husband or father, and now they're a caregiver, and this may not be their area of expertise. Like, do they have a place where they can just talk to somebody or gather resources?
One of our first presenters will actually be one of the caregivers. Phenomenal lady who is she in nursing school right now, or is she going to? Okay, I can't remember. But she works at the hospital and experienced this, and she will be speaking to the group on that first one about her experience with it. And she's been doing it for how many years? Do you remember?
Are you talking about our guest speaker?
Our guest speaker, yeah.
She's been a nurse for a long time.
Okay. So anyway, she's been a caregiver as well, and having her husband that has been that had a stroke. But anyway, she's going to give her experience with it and the things that she's had to. I don't want to say deal with, but the change in lifestyle, adapt.
Yeah,
the challenges that come with that, and raising children alongside of her. Some people, it happens later in life where it's just the spouses, but she's been raising kids and being a caregiver, and phenomenal lady. So get this, she'll be there to tell her experience, and then we'd like to hear from others and see how they're adapting to the new lifestyle change.
And just to reiterate, this isn't a one-time event.
No,
this is just kicking off
Right.
this monthly meeting where stroke survivors and family members thereof can go in and have the support group and learn from each other. Really, I think that's really cool. Is the dynamic learning environment that is created. You mentioned this individual that shared with the group how she came up with this mechanism to help her loved one, which was going to be helpful to all the rest of them in daily living. And that's, to me, that's awesome. I love inventions. I love ingenuity, and I love stuff like that. And so I think that's a huge plus for our community, and we need it because we've never had it before.
Right.
So I'm excited for you, and I think it's going to be an amazing new venture for the hospital. And they couldn't have picked better individuals as nurses to do it. I think you ladies are some of the best out there, and I'm so glad that you're doing it. Cody, did you have another question? You asked all your questions?
Yes, I mean that was a lot of it. Because now I'm worried about having a stroke. So I'm like, you know what?
Take care of
my right arm was numb.
I know.
You know,
like,
and
oh no, be fast, be fast. Get me to the hospital immediately. I'm super nervous now.
So I guess my question, my only other question I have lingering would be, do we see an increase in this like during these months, or is this just a Yuma thing, a need that we have year around? Do our numbers go up or down, or
Our stroke numbers, I feel like they might go up during the wintertime just because we have
The population of
the
older
population
community.
of human increases, but we have them throughout all the year. You know, it's not like our Tower 5 is the stroke unit, neural stroke unit. So we see all the strokes that come in, and some we fly over to Phoenix, you know, depending on their needs. But
There are a lot of patients that come through. So
we have a lot of patients that come through,
What can our listeners do from your experience before they go to the hospital? From my standpoint as a practitioner in the legal realm to help families, what would you tell clients to do? Or what can they do ahead of time to help in the process if one of their loved ones becomes incapacitated or has a medical emergency and needs to go to the hospital? What would help you?
In terms of
Legally being, covered.
are you talking, so documents, are you talking like that?
Sure.
Oh, yeah, absolutely. Like I was talking about earlier, if they don't have a plan in place already to say, hey, this is the person I want to make these life decisions for me. We're talking, you are unable to speak for yourself. We can't talk to you at all, ask you, would you like a breathing tube? Would you like us to resuscitate you? All these different types of things. When people are coming into the hospital and they can't make these decisions for themselves, we need to know what their wishes are. And if they haven't decided that ahead of time, they may get some life-saving measures that they didn't want. Or if a family member is like, no, they don't want that, and we don't know ahead of time, they might not get a life-saving measure that they may have wanted. So we want the patient to be able to have made that decision ahead of time. That way it's not made on the fly. It's not a last-minute decision that, wait, we didn't have the discussion with mom or dad. We have no idea what they want. Do they want to be resuscitated? Do they want to fight? Do they want to keep going? I don't know. So it's better if they have that decision made ahead of time, because then the family comes, here's the documents. Yes, they do or do not want to be resuscitated, and I'm the one that's going to be speaking for them. It makes our job a lot easier because we know exactly who to contact to, can we run this test? Yep. I'm the decision maker. I'm the healthcare power of attorney. So,
yeah. So if you have more questions about that, call my office.
Correct.
And we can help you put that in place. I had a question as you're talking about this event coming up on Wednesday. Do people have to RSVP to it? Can they, or just show up?
yes, they can RSVP. We have an email address. You want to tell?
yes, email address on there is going to be, do we have it on here? Oh, there it is. YRMC Stroke Support Group at yumaregional.org.
So that's a long one. Let's see.
Yes.
Let me see here. YRMC Stroke Support Group at yumaregional.org.
Yes.
Okay.
Yeah. So if you email that address, then we'll be able to put you down, count you.
No phone number.
No phone number right now. Nope. Just email us. This is a work in progress.
Yep.
So
We'll find out on Wednesday, what your needs are and how to better tweak things. Maybe a phone number in the future. I'm just kidding.
we did.
We do
I thought you had the full support of the admin, but
No, we do have it.
No phone
actually.
numbers.
We're registered in the American Heart Association website, and we do have a phone number there.
I just don't have it memorized.
so just call the hospital maybe.
No, I don't think they'll have that.
911. Don't call 911. That's bad advice. Do not call 911.
If you go to the American Heart Association, it's actually on their website. You'll see our email and phone number that you can actually call. I just didn't.
Yeah, we didn't.
Yeah,
add
I didn't bring
there.
it with me. But yes, so we are officially registered with the American Heart Association. You'll be able to see the information there as well.
I'm just going to plug the email one more time for our listeners. So YRMC Stroke Support Group. That's all one word.
Yes.
At yumaregional.org.
Yep.
Okay.
All right.
All righty.
All right.
Thank you, ladies, for coming in. I'm
you for
excited
having
for
us.
you. And we are blessed to have you in our community and doing this. We will talk to you next week.
All right.
This is Life, Death, and the Law.
Thank you.
Thanks for having us.
If you have questions or want to know more about something that was discussed today, please call the law firm of Beeson, Garner, and Hansen at 928-783-4575 or visit yumaestateplanning.com.